So just to kick things off, because this is a question I get really often, fasting.
Oh, yeah.
Intermittent fasting.
Yep.
We need to distinguish between the two, of course.
Yep.
Perhaps the most common question I get as it relates to males versus females is intermittent fasting, or time-restricted feeding, as it's sometimes called, an 8-hour feeding window, a 6-hour feeding window, a 10-hour feeding window. Is that something that perhaps differs in terms of its impact and how well it works for men versus women?
Yeah, that's the short answer.
Great.
Yeah. So I'll put some parameters around it, right? So if we talk about intermittent fasting, that's where you have like the 20-hour non-feeding window, or you're holding a fast until noon or after. And then we have time-restricted eating, and that's the fancy way of saying normal eating, where you're having breakfast and then you stop eating after, or you don't have anything after dinner, right? So you're eating with your circadian rhythm during the day. If we look at intermittent fasting, where you're holding the fast up till noon, or you're having days of really low calorie restriction, we see in active women it's very detrimental, unless you have PCOS or you have some other subclinical issue. And the reason for that is we as women have more oxidative fibers. So we hear about all the things about fasting to improve our metabolic flexibility, to improve telomere length, to improve parasympathetic activation. But by the nature of women having more oxidative fibers, we are already metabolically more flexible than men.
Interesting.
Yeah.
I didn't know that. Could you elaborate on more oxidative fibers, what that is, and how it relates to metabolic flexibility?
Sure. Yeah. So oxidative fibers are muscle fibers that are more aerobic capacity. So those are the ones that you can go long and slow for a very long period of time because it uses a lot of free fatty acids. You need a little bit of glucose in order to activate those free fatty acids. So when a woman starts to exercise, she goes through blood glucose first and then gets into free fatty acid use. She doesn't tap so much into liver muscle glycogen, which is, I think, another misconception that happens. So when we're talking about fasting or fasted workouts, trying to improve that metabolic flexibility, it increases stress on the woman. And so when we're talking about overall stress, we're talking about cortisol increase, and they can't hit intensities high enough with no fuel to be able to invoke the post-exercise responses of growth hormone and testosterone, which then drop cortisol. Mm-hmm. So from an overall stress perspective, that fasted workout and holding that fast for a long period of time increases cortisol. But then when we look from like a hypothalamic point of view, and we're looking at how the brain reads it, so we know that there's one area of kisspeptin neurons in the brain for men, but there are two for women. So the two areas are distinct, where one controls appetite and luteinizing hormone, and the other one is looking at estrogen and thyroid. So if you start having an exercise stress or a daily stress of getting up and going on with your day without fuel, you perturb those kisspeptin neurons and downregulate them. And so when you start downregulating them, we see that after 4 days, you have a dysregulation of thyroid. We have a change in our luteinizing hormone pulse, which is really important to maintain endocrine function. And we'll hear this, I've been fasting for so many years and it does great for me. But the other side of the question is, well, how much better would you be if you were to actually pay attention to your circadian rhythm and fuel according to the stress at hand, and knowing that you're going to garner less stress that way?